Okay, so let's begin where we left off. So advantages, disadvantages of breastfeeding. So in breast milk, there's over 200 different components that they've identified. Now the main components that we think of right off the bat are the fats, carbohydrates, and proteins. So similar to the nutrition that we get from our food, baby's getting it also from breast milk. But there's all these other defense mechanisms and antibodies and enzymes and vitamins and stem cells in breast milk. So here are your list of benefits for babies. So baby is at reduced risk for all these different things. And the extent of their risk reduction is related to the length of time they breastfeed. So if someone only breastfeeds their baby for like 6 weeks, the baby still is going to get some of these benefits, but not nearly to the extent of the child who's breastfed for 6 months or a year. Like especially these long-term childhood type benefits, like the reduced risks of leukemia and lymphoma, the reduced risk of allergies and asthma, the diarrhea, respiratory infections. These items, these are benefits immediately for newborn and into infancy. Necrotizing enterocolitis is a premature baby newborn type issue, so and SIDS as well. So some of these other benefits, the type 1 diabetes, the asthma, the allergies, the obesity, these are benefits that stay with baby and last into childhood. Okay, and then the pain down here at the bottom. So when we do procedures on babies, like if we do heel pokes for blood sugars or things like that, or give IM injections, like we would like baby to be breastfeeding the moment we're doing those things, because studies are showing that babies exhibit less signs of pain when they're breastfeeding compared to when they're not. So great stuff for baby. And then here are your benefits for mom. So she's at reduced risk for ovarian and breast cancer and uterine cancer and type 2 diabetes, heart disease, stroke in older adulthood, hypertension, osteoporosis in older adulthood, decreased risk of postpartum depression, like immediately after, with that baby, of course. And then as far as pregnancy or birth control, breastfeeding can be a form of birth control, but I tend to like to discourage that, because they really have to be exclusively breastfeeding and be amenorrheic, so not having a period. Okay, so that means that mom has to be breastfeeding every day. All the feeds are breastfeedings, in through the night and all through the day, and she needs to be doing this exclusively. So at 3 months, at 6 months, she needs to be exclusively breastfeeding. And a lot of times that doesn't happen, and the woman is feeling like, well, I breastfeed, so I should be covered for birth control, and then ends up getting pregnant. And many times it is because she's not exclusively breastfeeding. Okay, so here's some advantage of breastfeeding. Like it increases her mom's self-esteem, her ability to care for her baby exclusively. Like she is the only one that can feed this baby, that has the ability to provide nutrition for this baby, because it's coming from her own body. So this is really builds mom's self-esteem, and makes them feel empowered as mothers. It, of course, enhances bonding, decreases stress on mother and infant, and moms learn the baby's behavioral cues better. Okay. Other advantages, of course, cost saving and no preparation. Cost savings, yes, we're not buying formula and bottles and nipples and all those kind of things, but mom has to have good nutrition. So if she's not able to afford good nutrition, then we need to be referring her to the WIC program, Women's, Infants, and Children. Okay. Disadvantages of breastfeeding is, excuse me, sorry, pain, nipple tenderness, and nipple tenderness should subside if the breastfeeding is correct. The latch, things like that, the nipple tenderness should dissipate very quickly. But anyways, disadvantages. So leaking of milk in the breasts. You're at the grocery store, you hear a baby cry in the next aisle, and your blouse is soaked now because you've just leaked breast milk all over yourself. Embarrassment about breastfeeding. So there are some circles where breastfeeding is not supported, and actually it is criticized. And this is horrible. I want to hit people over the head when they do this. But you've probably seen on Facebook or some articles in the newspaper or on television about people being treated badly for breastfeeding in public, and that's horrible. So anyways, so here's some disadvantages, okay? Perceptions about diet restrictions. Now, there really isn't any particular diet restrictions for breastfeeding. There's some taboo things like don't eat cabbage or gas-producing foods because your baby will be gassy. Don't eat spicy foods because it will hurt your baby's belly. All those kind of things. Well, what we tell our parents is to try the food, and if you don't notice any problem, your baby having any problems after you breastfeed, then it's probably going to be tolerated well. So the one thing they do need to keep in mind, though, is, alcohol. That needs to be in check. Not saying that women who breastfeed can't have a glass of wine or a beer or something once in a while. That's okay. But medications for certain, like they want to make sure that they check with a lactation consultant or the pediatrician to see if whatever medication that they're using, if it crosses the breast milk and cause problems with baby. The other thing is we need to instruct them about especially over-the-counter medications, because they think, well, this is over-the-counter, it's safe. One, it might not be safe for the baby, but number two, it might not be safe for your breast milk supply. For instance, if a woman has congestion, sinus problems, upper respiratory illness, and they're all congested and snotty and everything, and they take Sudafed or really any medication to help control congestion, a decongestant, that dries up their sinuses, it dries up the mucus, it dries up their congestion, it dries up their breast milk. So we need to kind of instruct women on that, okay? So disadvantages, it is a limited, it can be used as a birth control option. However, it's not a foolproof option, and it also limits the other availability of their birth control options. So all these things need to be addressed. So there are some contraindications with breastfeeding, TB, herpes. So I'm not so certain that this is accurate about herpes. If she had herpes lesions or an active infection, then maybe not. But I don't think this is correct as far as women who have herpes not being able to breastfeed. Okay, but if it's an active infection, no. And of course, if she's doing illegal drugs or if she's smoking cigarettes, baby will get the nicotine. But there's a lot of women who smoke cigarettes and breastfeed. But illicit drug use that is going to cross into the breast milk. And then prescription medications, we need to make sure that those are compatible with breastfeeding. So when we talk about breast milk, so the first breast milk that the woman produces is called colostrum. It's the initial milk. It's the milk that she has available the first 3 to 5 days after delivery. Colostrum is very thick. It's a creamy yellowish color. It's very concentrated. It's like just a really concentrated, strong, beefy, but it's a very small amount. Colostrum is a very small amount. Okay, so babies need to breastfeed frequently during the first several days to get enough nutrition from the colostrum, but also to stimulate mom to start producing milk, and for her production and her milk to come in. Okay. Lots of antioxidants. IgA is passed through the colostrum. Promotes lactobacillus bifidus, so that is your GI bacteria, your good bacteria, your normal flora, good bacteria in your gut. So we want to get this going for baby right away. That will protect a baby's gut and baby's immune system in general. Okay, a laxative effect. So baby starts passing that meconium. Now, transitional milk is the milk as colostrum is changing into mature milk. It's transitional milk. It's a lighter yellow, has more volume, of course, in the colostrum, and the fat and the carb, lactose, vitamins and stuff, those are starting to increase as well. The foremilk, we'll talk about foremilk and hind milk, but the foremilk, so if we're talking about mature milk, so there's the mature milk has different quantities of nutrition depending on what part of the milk we're talking about. So the foremilk is the first milk that flows from the breast when babies start feeding. And I could not tell you myself what quantity that is, but the first small portion of milk, so maybe the first quarter amount or the first a third of amount of her volume. I'm not really sure, but it's the first part of the milk. It's a little watery, but it's really high in protein. Okay, and then the mature milk, or the bulk of the milk, it has a whitish or bluish tinged color to it, and it has more of the fats, carbohydrates, proteins, and fats, and a large water content. And then as baby continues breastfeeding, then baby gets the hind milk. It's the milk, the last milk, so the milk at the bottom of the glass. Very high in fat and calories. So we like babies to get the hind milk, okay? So this is one of the reasons why we tell moms to switch the breasts each feeding. Like, for instance, if the mom started her feeding at 8 in the morning and she started on the right side of the breast, or she started on the right breast, and irregardless of whether she moved to the left or just fed on the right side, the next feeding at 10 a.m., she's going to start with the left breast, okay? And then she's going to feed her baby either just on the left breast or on the left and right breast. But then the feeding at noon is going to go back to the right breast, and then the next feeding is going to start on the left breast. So we want her to alternate that way, because then babies will have a better chance of getting this rich hind milk. Okay. All right. So when I would have liked to have shown you the video of the breast milk crawl, but it's kind of lengthy, and you can Google it if you want and read a little bit about it. But basically, the breast milk crawl, breastfeeding crawl, or breast milk crawl, is when we put babies skin to skin on mom's chest. If we don't touch the baby, but the baby is supported, so it's not rolling off, but we don't do anything, the baby will eventually henpeck its way up to the breast and latch on themselves. But anyways, we don't have time for that because we're nurses and we're very busy. So we need to get this feeding going. We like to get breastfeeding initiated within the first hour after delivery. So what we tell moms is when babies start showing signs that they're ready to latch on, let us know. And those signs are called feeding cues. So the baby will be, if baby is skin to skin with mom, the baby might be bouncing its head up and down on mom's skin. Baby will be licking their lips. Baby will be opening its mouth and turning towards stimulation that touches the cheek or the lips. The hands will go to the face, things like that. Those are called feeding cues. Now, when baby starts to scream and cry, that's a late feeding cue. So there were cues before baby threw a big old fit that we missed, okay? The other thing that we'd like to know is baby's bowel sounds. Have they kicked in and started going yet, okay? There's an absence of abdominal distension. So when I go to latch a baby on, I don't listen to bowel sounds every time. I don't look at baby's abdomen to see if it's distended, okay? I cover those things in my initial assessment. So anyways, those are your feeding cues. Those are the things that you look for when it's time for baby to feed. So we tell moms that babies can feed on demand. So while they're in the hospital, these first couple of days and before the mature milk comes in, we say, feed that baby on demand. Every time that baby wants to feed, let that baby feed. So, that can be very exhausting to parents, so we need to be really supportive and help them. But this is really helpful for moms' breast milk to come in larger volumes and as soon as possible. Okay, so what sometimes ends up happening is baby, hold on, sorry, I'm getting sleepy. Baby does what we call cluster feeds. So there'll be 5 to 10 feeding episodes in a 2 to 3 hour period. So mom will latch that baby on, baby will feed for 5 or 10 minutes and then fall asleep, and then everybody starts doing their own thing, and then in 5 or 10 minutes baby's rooting around wanting to feed again. That can happen several times in a 2 to 3 hour period. They're called cluster feeds, okay? But then if we don't have baby that is latching on or wanting to feed within 2 to 3 hours, in these first couple of days now, we're still at the hospital, then we try to wake baby up and we try to get baby to feed. We don't want to just sit there and watch baby sleep for 6 to 10 hours without even attempting to wake baby up and stimulate baby to feed. Now, babies will either wake up and feed or they won't wake up and feed. But we try to get baby to wake up. So things that we can do: we take the hat off baby, we take baby out of the blankets, we hold baby up, mom talks to baby, mom touches baby, mom puts baby to the breast and tries to stimulate the baby's lips with her nipple to get baby to wake up and latch on. We can even take a wet washcloth and kind of stroke the baby's cheeks, or maybe stroke the baby's back or the baby's head to kind of just like wake baby up. Now, when we've done that for 5 minutes or even 10 minutes and we just can't get this baby to wake up, then it's time to stop and let baby sleep and then try again in an hour or so, okay? But babies will have periods, especially in those first couple of days after delivery, where they'll have long sleep periods where they won't want to wake up and eat, and that's normal, but we still need to try to do our part. So when mom's breast milk does finally come in, then usually babies are feeding every 2 to 3 hours without having to be woke up, okay? And then it is okay if they have one stretch at night where babies sleep for 4 to 5 hours, okay? That helps get that nighttime sleep pattern initiated, because sometimes it can be really terrible if your baby thinks that they're supposed to sleep all day and be awake all night. So that's kind of horrible to try to get through. So anyways, we can have the 4 to 5 hour stretch at night where babies sleep. Now, if it's getting close to 5 or 6 hours, a lot of times moms will wake up so engorged and uncomfortable. They're like, okay, baby, you are eating whether you like it or not. Okay, so those things can happen. Now, formula-fed babies don't eat every 2 to 3 hours. They usually stretch every 3 to 4, and sometimes even have a longer stretch at night, just because the formula, is a processed food. It sticks with baby longer. It feels, their bowel has to process. It takes longer for their bowel and their gut to process this food, so they can feel fuller longer. Okay. And what we're looking for when babies eat and say that they're done is, they have, so they'll be suck, 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 swallow, breathe, suck, 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 swallow, breathe. So there'll be longer pauses in the breathe part where it seems like they're falling asleep, okay? You can feel their body relax a little more, and they could just absolutely fall right to sleep, okay? So then that is the signal that we're done eating. Now, for breastfeeding positions, there are several positions that we like to instruct mom to use, and we do like mom to switch up these positions. The more she switches these positions, or the more often she switches these positions, the more thoroughly she empties the entire breasts. Okay, so if she's always doing one position every time she feeds, she's still going to empty the breast. They're still going to refill. But when we change these positions, we empty other areas of the breast more completely than if we're just in the same position every time we breastfeed. But anyways, there's the modified cradle position, or what's called the cross cradle. And then there's the cradle position. Now, this is where I wish I was standing in front of you so I could show you these. Next time we meet, if someone wants to remind me, show me those real quick, but I'll try to explain them here. So a cradle hold is just the way people hold babies. The most common way you see people holding babies, with the baby's head in the crick of your elbow and your arm underneath the baby's body, supporting baby, okay? That's the cradle hold. The cross cradle is basically baby is in the same position, okay? But instead of baby's head being in the crick of your elbow, you take the opposite arm around baby's body, cradling baby's body to mom's chest, with that hand supporting the back of the baby's neck instead of the crick of the elbow on the other arm. You see why this is kind of difficult to explain. So anyways, those are different ways to hold your baby for breastfeeding. The other position is the football hold. So basically you're tucking baby kind of on the side of the chest, under the arm, like you would tuck a football and run with it, okay? The side lying hold position this is where mom and babe are both in bed. Mom is laying on her side facing baby. Baby is laying on her side facing mom, and baby is breastfeeding off that lower breast. And then they flip over and do the other side, okay? The important thing about whichever position that we're using is that we make sure that mom gets baby belly to belly. So baby's belly facing mom's belly. That the head and neck are aligned and straight. Okay, so like we don't typically turn our head to our shoulder and drink. Okay, so we want baby's head and neck straight in alignment. Okay, and then we take baby's nose and line baby's nose up with the nipple. So that makes baby have to extend their head a little bit to latch onto the nipple. And so that creates a nice open esophagus, a nice straight aligned way to feed, okay? So when we're doing our latch on, so baby's nose is to the nipple, and then baby extends their head a little bit and opens their mouth, and then mom brings baby to the breast, not the breast to the baby, and the lips are on the areola of mom's breast and not on the nipple. Okay, baby will get a feeding if she is on the nipple, but she won't get as full of a feeding as if baby is on the areola. Okay, and then also this will cause less trauma and soreness for mom if baby is on the areola. Okay, so please watch that video. It's excellent in showing you this. Okay. So mom will take her nipple and she will touch baby's lip or the corner of baby's mouth, and this will elicit the rooting reflex. Baby will open their mouth, and then baby latches on. Okay, so we draw the baby in. We don't draw our breast to the baby, and then we watch and observe baby sucking, the deep jaw movement, not just the cheek dimpling. So if we see deep jaw movement, we know we've got a good deep latch. And then we listen for the sounds of this swallowing. There's one other thing I was going to say here. And then we look at the baby's lips when baby is latched on. They should, both the bottom and the upper lip should be flared out like a tulip or like fish lips. Okay, and that's the correct position of the baby's mouth. All right, so how often do we feed? So we feed approximately 8 to 12 feeding sessions per day. So we used to tell moms, you need to feed your baby every 2 to 3 hours. Well, sometimes that seemed a little rigorous. So we tell moms you need at least 8 to 12 feeds in a 24-hour period. So if you're feeding baby every 2 hours and then baby goes a 3 to 4 hour time frame, and then maybe feeds every 2 hours, maybe every 1.5 hours, who knows? But as long as there's 8 to 12 feeds in a 24-hour period. Excuse me, and that babies are feeding for about 10 to 20 minutes, okay? Moms can feed on one or both breasts. I like to encourage both breasts, but sometimes if babies get a good full feed on one breast, they will be satiated and not interested in the second breast. We just need to make sure that mom is switching breasts each feed. So again, if she starts on the right breast with this feeding session and then baby eats their fill and goes to sleep, irregardless of whether baby does just that right breast or does both breasts, then at the next feeding session, mom needs to start with the left breast and just switching that off, okay? Now, how do we tell if baby's getting enough breast milk? Because we can't measure it. Well, one, we're going to tell moms, our baby's eating 8 to 12 times a day. Are they feeding for at least 10 minutes each feed? Okay. And then are they peeing and pooping? So this is kind of the schedule that we tell them about. So on day 1, baby should have at least 1 void. On day 2, baby should have at least 2 voids. Day 3, 3 voids. Day 4, 4 voids. Day 5, 5 voids. And day 6, 6 voids. And forevermore, 6 voids. Okay. Kind of similar to the stool. So day 1, they should have at least 1 stool. Day 2, at least 2 stools. Day 3, at least 3 stools. Day 4, 4 stools. Day 5, and forevermore, they should probably have at least 3 to 6 stools. Okay, they may have more, but at least 3 stools. Okay, this is a breastfeeding mom. Okay. And this is pretty similar with bottle feeding as well. Babies may not stool as much with the bottle feeds, but they will probably have bigger stools and way stinkier stools. And then the other thing that we talk about with moms is hand expression. Now, this is really important in the first 24 hours. The studies are showing that mom's breast milk will come in sooner and in larger volumes and be more consistent throughout her breastfeeding experience. So 6 months, a year, okay? And it all comes back to hand expression in those first 24 hours. So we like to instruct moms and show them right after delivery with that very first feed how to hand express. We instruct them to hand express after a breastfeeding, okay? And there is a very particular way in which hand expression is supposed to be done correctly. And I would like to show you that. I'm not sure that that video showed that very well, but so we teach them how to hand express right after each feed. They just get some drops, okay, guys? It's not like they're hand expressing a whole bottle full. But they get some drops, and we collect that in a spoon. So she expresses, we hold the spoon right there at the nipple, the drops go in the spoon. We can either take that spoon and put those drops in baby's mouth, or if she got a large spoonful, we could even suck those up with our breastfeeding syringes, special syringes we use for breastfeeding. We can suck those up out of the spoon and squirt those in baby's mouth, okay? Hand expression is more effective than using a breast pump in that first 24 hours, or at least until the breast milk starts coming in, okay? But then after that, then their breast milk comes in, and then they're breastfeeding baby on a schedule, and they don't have to be hand expressing all the time. But in that first 24 hours, we really like them to do that, okay? So then most women will switch to a breast pump, usually an electric pump. I advise my patients that buy the most expensive electric double breast pump that you can afford, okay? Some women can't afford a double breast pump, where a double breast pump is where it's set up for that you can pump both breasts at the same time. Sometimes they can only afford a single breast pump. Sometimes they can't afford the electric breast pump, and they do have battery operated breast pumps, and they do have breast pumps that are used with a hand pumping mechanism, okay? So we tell them they can pump their breast after feedings 3 or 4 times a day. They'll start storing that milk, okay? And then if they're not with the infant, and this was a time the infant usually is feeding, then they need to pump. So like especially for women who go back to work. So if their baby wakes up in the morning and breastfeeds at 8, and then breastfeeds again at 10, and then breastfeeds again at noon, and then breastfeeds again at 3 or something like that, whatever the baby's routine was, and that's when the woman should pump, okay? Because we want the woman to continue her supply. So if baby is used to breastfeeding 8 to 12 times a day, and the woman goes to work and she only pumps 1 time in 8 hours, then the body is going to be like, oh, well, I need to slow down production of breast milk. I need to not be producing so much breast milk. So eventually that woman's breast milk is going to start slowing in production. She's going to have less quantity of breast milk, and she might not be able to continue breastfeeding for as long as she wanted to because she doesn't have enough breast milk to feed her baby, okay? So that's why we want to pump when we're not with the baby. Now, storing the breast milk, there's lots of information about storing. Can we just keep it sitting on the counter? Can we store it just in the fridge? Do we need to freeze it? What do we freeze it in? So the little plastic milk bags, you can get special breast milk ones that Ziploc, or you can get the kind that you put in a bottle, the plastic liners that you put in a bottle, and you can fold those over and tape those down and store your breast milk in that. And then you want to date your breast milk, because when you start taking breast milk out of the refrigerator or freezer, you want to take the oldest breast milk out. So you want to use the oldest so that it's not like being in there too long and spoiling and being not usable, which is rarely the case unless it's sitting in there for 2 years. So here is a diagram on where breast milk can sit and for how long. Okay, so if she's just pumped her breast milk, or she's thawed her breast milk and it's sitting on the counter, it can sit on the counter for up to 4 hours. Okay, it can sit there longer, like 6 to 8 hours, if this breast milk, if she just pumped this breast milk. If it came straight from her breast to the counter, it could sit there for 6 to 8 hours. Okay. But usually what people do is they're pumping breast milk and they're storing it so that people can use it when mom's not able to feed the baby. So mom went back to work, or maybe dad's going to start feeding baby at night or whatever. Okay. But anyways, it can be in the refrigerator for up to 4 days if the milk has been, if it's not fresh out of the breast milk. Okay. It can be in the refrigerator for 8 days if it is fresh out of the breast milk. Okay. In a freezer, it can be, so usually this type of freezer we're talking about is a freezer that's attached to your fridge. Okay. It can be stored in there for up to 9 months if it's at least 0 degrees Fahrenheit in there. Okay. If it doesn't freeze that long, then it's probably only good for about 3 months. Okay. I mean, if it doesn't get that cold in your freezer, it's probably only good for about 3 months. Okay. And then if it's a deep freeze or a chest freezer, it can be stored in there for up to 12 months. The other thing that we need to talk about, so whether the breast milk was in the fridge or the freezer, how do you thaw it? So you can set it on the counter and let it thaw at a room temperature on its own. That takes, if it's frozen, that takes several hours. Okay. So if you have frozen breast milk and you need to thaw it more quickly, then you use hot tap water. Okay. Get a container of hot tap water, put the breast milk in there, and let the breast milk thaw in the hot tap water. Never, 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 never boil, and never, never, never microwave. Okay. All right. Now, for bottle feeding, we need to make sure that we teach parents how to bottle feed appropriately. Let them know that babies are only going to feed for about every 3 to 4 hours. Let them know symptoms of feeding intolerance, which is when they're spitting out large quantities of formula or spitting it across the room. Okay, like they're possessed. If a baby burps and some formula comes up with that burp, that's okay. That's kind of normal. Okay. But we don't want babies vomiting huge amounts where it seems like it's the whole feed. We don't want them shooting it across the room. And if they fed 3 or 4 hours ago and they're waking up now and all of a sudden they vomit this huge amount, like the whole amount you fed them, then that's a sign of feeding intolerance. Okay. So we also want to instruct our parents not to feed the babies too much. It is very easy to overfeed a baby with a bottle. And if you overfeed a baby with a bottle, they might vomit a large amount because it's way too much for their little tiny belly. Let me tell you that a newborn's belly is the size of a marble. Okay? We're feeding these babies, bottle feeding these babies 15 cc's. In a couple of days, maybe 30 cc's. That's such a small amount. Okay, so we really need to be instructing these patients or these families on the appropriate amount to feed their baby. We're going to watch babies' pees and poops. We always want to make sure that they're holding the baby in an upright position, that baby is not laying too flat or too reclined, and that they're not propping the bottle. They are to never prop a bottle. Okay. And And then there's all kinds of bottles and nipples. They're all very wonderful and great. Buy expensive, fancy ones if you want. Buy cheap, effective ones if you want. But one of the things I do instruct them on is to use a slow flow nipple. So the packages of nipples will say slow flow, or I don't think they say fast flow. But look for slow flow nipples, okay, on the packaging. So with slow flow nipples, the babies do need to suck harder. They need to be more intent on sucking for nutrition, and it's a little more difficult to overfeed your baby. So if you've ever held a bottle, turn it upside down. It will drip, okay, milk out of the nipple. So babies don't even have to suck on the nipple. It's going to come out. But they do use their tongue to control the flow. So I tell them to get a slow flow, okay? Now, how do you prepare formula? So there's different formula preparations. There's the powdered, the concentrate, and the ready to feed. The powdered is, there's a scooper in there. It tells them how much scoop for each 4 or 8 ounces, and then how much water to use. And then you need to shake this all up, heat it with hot tap water, just like breast milk. Don't boil or microwave, and then feed your baby the formula like that. Now, the water, so sometimes people will need to get their water tested, and some people, if they have well water or water with, stuff in it, they may need to boil their water before they can use it to feed their baby with. Some people buy water in the jug, so whatever you do, you can do, okay? So the package instructions will tell them how to prepare the bottle. The concentrate, so it's a liquid formula, very concentrated. You still need to mix it with water. And the ready to feed, it's ready to feed. Like, you don't need to mix it with water. Now, when you feed a baby formula, you've made the formula, whichever kind you've used, and there's still formula left in the bottle, but the baby's done. Okay, you can save that bottle for 60 minutes. If baby doesn't wake up and say, "Oh yeah, I want a little bit more," within 60 minutes, you need to chuck it. You can't save it. You can't pour it in the big jug of formula. You can't put it in the fridge and then pull it out and heat it up and reuse it for later. Okay, it has to be chucked. So teaching parents to make the appropriate amount for what their baby is eating is a good thing to do as well. So sanitary precautions, well, prepare your formula according to the package instructions. Don't use expired formula. Always wash your hands, wash the supplies. Replace your bottles and nipples when they start getting damaged. Make sure they shake the formula thoroughly, especially if they're using the powdered formula. They say to run the water for a minute and to use cold water when mixing your formula, and then heat it up, okay? You can, if you're making formula to put in a bottle to transport for the day, use frozen packs to keep the formula chilled. Bring your own water if you're going to be places where you don't know the integrity of the water, and then teach them about not overfeeding and not adding anything to the formula. So a lot of times people will start putting rice cereal, baby cereal, in bottles of formula and feeding that to their baby, and people do that at night. Makes babies fuller so that they sleep longer. So don't do that. Okay, cultural things. So I did just want to mention some of these things. So depending on the culture, they have their different views of breastfeeding. Okay. Some cultures believe that if the mother is angry, that will spoil her milk. Some cultures disapprove of breastfeeding or disapprove of it in the public. Some cultures believe that the colostrum is unclean, and they They don't feed the baby the colostrum. They wait till the woman's mature milk comes in. Some people breastfeed their babies for 6 weeks and then they're done, and some breastfeed their babies for 4+ years. Okay, I'm sure there's probably a lot of other different things, but just be sure, if you have any indication that there's some sort of cultural beliefs in regards to breastfeeding, that you're aware of them, and that you're sure that things are going to be safe for both mom and babe. Okay. All right, guys. Sorry, I thought I would get through two chapters in one lecture, but anyways, here is your second recording, and I will see you guys next week.